Okay, so we're recording. Good evening, everybody. My name is Donna Ma. I am standing in the very big shoes of Thomas Leung, the CEO of Kamwo Meridian Herbs, and we're very pleased to host and be back hosting meetups. This was part of our tradition at Kamwo to do in person and live, and we're not quite there yet, but after a long hiatus of being sort of driven underground in the pandemic, in just recent weeks, we've brought back the meetup, and it's been kind of exciting to see people again in this professional share network. So welcome and thanks for being here. Centuries ago, Chava and I actually sat across from each other at Kamwo when we worked together when she was the COO for Kamwo, and our desks like literally faced each other. And so it's kind of fun being in this sort of face-off in virtual space. And I'm really pleased to introduce her. She is a doctor of DACM, doctor of acupuncture and Chinese medicine, an MSTOM from the Pacific College of then Oriental Medicine, and an LNT, and is currently practicing out of Brooklyn and is on faculty at Pacific College as well. So I'm pleased to welcome Chava to discuss kind of out of her handbook of clinical pearls, some good information for us about the treatment of cold B. So virtual applause. Welcome.
Thank you, Donna. Thank you for everybody who decided to show up and talk about cold diseases when the weather is finally changed and blossomed. But I thought this was kind of timely. I'm going to share my screen so you don't have to only look at my face. So it's interesting because I think I have been interested in this area for a while, meaning the using herbs for the treatment of pain. But I think I was like most people in that when a patient comes into the office, I was relying mostly on my needles, right? Or the gua sha, or massage, or cupping, whatnot, all of these like more tactile applications. And then COVID happened, right? And so we had this kind of experience of this mass experience of a cold epidemic pathogen. And then we had our populations of long COVID people, of our vaccine reaction people. This is certainly not an anti-vaccine space, but I think a lot of us are seeing different changes in our patient population. And they're mostly cold associated. The beginning of the shutdown, when we weren't practicing in the office, I think, myself, like most of us, we started to see people on Zoom and other platforms and give them herbs and give them diet advice and give them all sorts of advisement remotely. And I ended up having a good influx of pain patients, and got people who were my regular patient for whatever. Now they had a pain, right? And so we had herbs, so we would treat it with herbs. That also, when I was full-time at Kamwo, for a while I wasn't maintaining a physical office, and I was treating people with herbs primarily. And through those two experiences, I kind of got comfortable with the idea of like, oh, my back pain patient, I don't have to think about always the trigger points and the this and the that and getting them into the office. I found that something that was sometimes an uphill battle was getting patients into the office enough, right, with a spasm or acute debilitating pain, or things like getting them to come long enough, right, where we could get them out of a back spasm or a headache, something like that. But we didn't fix it, right? We're in the place of management versus the zone of full correction, right? So I thought this would be a good topic because I think we're seeing a lot of this lately, and then it offers you a different option if your patient can't get into the office, or if you just want more rapid resolution, right? So um, certainly we will see quicker and more complete resolution with the inclusion of herbs. It doesn't have to be a big show, right? Like I think a lot of people are like, well, are raw herbs the best? The best herbs are always the ones that your patients are going to take. I will advise that you try to counsel them on an option where you have the ability to do modification. Over the years, I'd like to speak to patients about like what is an obstacle to herbs, right? Is it cost? Is it taste? Is it time investment? Is it all of those things? Like, what's the issue, right? If it's quality control and things like that, all of your vendors in the US should be able to secure you C of A papers or certificate of analysis papers where you can have the lab results for the lot of the herbs you have in your hands. But over the years, I've started to go from being like a very purist, like really you want to do the raw herbs, to let's be a little softer on the edges about this. If I can get my patients to take granules, then great, that's what we're doing. If I can get them to cook raw herbs, then maybe they don't have to hover over the stovetop, right? So I've had good experiences with coaching patients to do things like cook raw herbs in the crock pot on low overnight.
I didn't
right?
have the right link, which
And
is frustrating for me.
then also things like if you have one of those old thermoses, putting a bag of raw herbs in there and filling it with boiled water, letting it sit for a couple hours, and that being enough in many cases to get you a good potent formula. If you're using a third-party pharmacy, things like Kamwo, things like Fat Turtle in LA, there's Zizai in Colorado, they will do vacuum packing, so they can create liquid extracts. That increases cost for the patient, but it might increase compliance if they don't have to do anything. Those are going to be raw herbs that are extracted in an industrial extractor, and it's a closed environment. So you're not losing any volatile oils or activity in the cooking process. So they're quite potent, and then there's some data that would say, some people would say that they may be, they're at least equivalent. In some cases, they may be stronger than what you can cook on the stove top because you're not losing anything. The general dose for vacuum packing is the same as raw herbs. One bag makes like 2 doses, right? But with adults, standard adults, I have found good clinical effect just doing like 1 vacuum pack a day, maybe twice a day in active pain, like a loading dose, and then you can roll back. Another area I think that we can look at for both compliance and cost is ground raw herbs, right? So granule herbs are extracted herbs. No matter what your brand is, all of the American vendors are basically subcontracting out of the same 8 pharmaceutical factories in China, Taiwan, Hong Kong. So there's a lot of competition amongst brands and saying this one's more potent and that, but they're all basically have the same contracts. They're not tons of facilities that have the appropriate certification with the FDA and USDA and all the CITES and things like that. So my point there is that granules are great. They're clinically effective. They're convenient for your patients, but they include a lot of inert starches. The end product, no matter what your brand is about 25 to 50% inert starch. So that's not a problem. It's hypoallergenic, it's GMO free. These are universal pharmaceutical binders, but they can give some people bloating, even if there's nothing in there. There's allergic to, and because they're processed, they're a little more expensive, sometimes more expensive than raw herbs, which won't have any additives. But when we think about treating things like pain, we want movement, right? We're from the first semester of school, we're taught that areas of localized pain and disease equals, on some level, Qi and blood stagnation. And we, on some concept, we need to move that, right? A lot of what I want to talk about tonight is really on like a micro circulation level, like this capillary exchange, lymphatic capillaries, and venous capillaries. If we look at a lot of formulas that move Qi and blood, right? Sini-san, Xiaoyao-san, right? A lot of them are san formulas, meaning powder, right? Where historically we'd be grinding raw herbs into a crude or fine powder and cooking as a draft, meaning you can boil water and throw a dose in and basically turn off the heat. It takes not a lot of time investment at all. When you cook herbs like that, you're getting more surface area exposure to the water. And so we need less herbs. So if you want to give patients raw herbs and you want to reduce cost, you can have them ground. If you want to commit to it, you can get an herb grinder that's very reasonable for about like $190, $200. If you're going to use it, then I think it's a good investment. You can usually have the pharmacy do that, and there's usually a surcharge, but often they'll ask you for a minimum, like they might ask you for like a pound of your formula. But if that's your volume or you have something you use frequently, it might be worth it. So you can have patients take the powder, add it to boiled water, and then consume it, or you can easily encapsulate it. There's some restrictions in that you don't have a good option for long cook herbs, but you could substitute some ingredients with granules. So there's some ways to kind of approach this with patient management, but I would start with conversations about like why it's important to include herbs here. And number one, it's going to support anything that you're doing with acupuncture. Acupuncture is very dose specific. Anywhere outside of the US, right? If you're talking about the mainland China hospital system, people who are outpatient are coming for acupuncture 3 times a week. And they're also getting moxa, gua sha, and eastim in that 3 times a week. That's very standard. If they're inpatient, it could be once or twice a day. Now we kind of flip over onto this like therapeutic model in the West of once a week. For chronic stuff, that's okay. When somebody's in more urgent pain, we want a quicker resolution, right? And so herbs can support that progress. We can also treat people remotely. We can treat underlying issues, right? If you've ever had the experience where you give somebody a great trigger point treatment and they feel great, and then but they keep coming back because they're not holding the treatment, it's likely, especially with chronic presentations, that there's deficiency underneath, or there's stasis at the level of microcirculation that just needs like a heavier hand. So herbs can be our support to get through this. I want to be clear on the outset. I'm used to talking for 3 hours at a clip. I'm not going to do that to you tonight. Donna's going to be my timekeeper. Also, I wanted to mention that this is more, it's less about like, I think I'm a very clinical herbalist, right? And so this is very much how I practice and approach this issue, less about like the Shanghanlun says, right? Which I don't discount, but I just wanted to put it in that perspective. But I welcome any questions that you have. So I want to speak about using herbs for treatment of rheumatic disorders. And I think a lot of the times we jump to the idea of joint pain, but we're talking about really the full musculoskeletal system, right? Yes, joints, but also muscles, connective tissue, all the sinew. When things become chronic, when they become progressed, we can have invasion into the skin, into the vessels, into the organs. And especially things can get out of control in when the etiology is from autoimmune conditions. So we can see clear clinical pictures of cold. However, you might see a patient with an autoimmune condition that's cold in origin, but heat in current presentation. When we're talking about adult patients with modern lifestyle taxation and long histories of illness and therapeutic interventions and trauma history and this, that, and the other, we should expect many layers of treatment. We have to, if there's excess heat, we need to address that, whatever's on the top, right? But often when we get down below, we'll start to show true level of deficiency or stasis that needs to be worked through. So in a Western sense, rheumatic diseases are associated with pain. It can be pain of soft tissue, ligamentous tissue, but also joint. There can be swelling, certainly decreased range of motion and flexibility. Fatigue and malaise. Malaise is just this term for not feeling well, what we call the FLC, feeling like crap syndrome, right? Where we just feel off. Fevers. If this is an autoimmune presentation or other thing that we would correlate with an inflammatory condition, we may see excess overlay of heat, even when something was initially cold in origin. Or we could be talking about shulao, like qi deficiency fevers, blood deficiency fevers. It takes a lot of energy emotionally, and it takes a lot of qi and blood to remain in chronic pain. So often those patients do need to move qi and blood, need to clear heat, expel cold, need to resolve phlegm, but they also end up needing tonification, right? Little bits at first, and then to growing, because the body needs to be like re-strengthened. Weight changes. Traditionally with rheumatic disorders, we'll see weight loss. However, we can see loss of muscle tissue with some water weight gain, right? So generalized edema or upper or lower body edema. So we certainly think about things like arthritis. Osteoarthritis is actually not considered a rheumatic disorder in biomedicine. But here we'll include it under our umbrella when we look at this in a Chinese medicine context. But when we talk about rheumatic disorders in a Western context, we're talking often about inflammatory arthritis, reactive arthritis, rheumatic, rheumatoid arthritis, gout, ankylosing spondylosis. We don't want to forget that pathologies are not only going to enter the joints, but all the surrounding tissues. So something like scleroderma, which is from abnormal production of collagen in a particular area, creating these areas of thickened skin that usually don't cause pain, or it's maybe sometimes mild itching, but they can be disfiguring, or if they cross a growth plate in a growing child or a joint, then they can be limiting of range of motion. Then there are less common subtypes where we can be, they can be something quite disfiguring, or we can have systemic scleroderma, which will lay down that excess collagen in the heart or the gut or the lungs, right? And can cause something like a myocardial infarction or aneurysm. This will be associated with an autoimmune response. In the context of Chinese medicine, this is often cold damp. It starts with cold damp that just gets stuck in the tissues, and the body doesn't have the strength to push through it and expel it, and it just builds. Lupus, I think if we look at the classics, we don't have a lot of writings for things that correlate to lupus today, maybe fragmented stuff, but we have a lot of modern scholars and practitioners in mainland China and Taiwan specifically come to mind, who are treating autoimmune conditions, and specifically a lot about lupus. And pretty universally, it's looked at as original deficiency in the body with invasion of wind, cold, damp. And then over time, this will garner more stasis, phlegm development, heat development, and then it can present as a terrific explosion of inflammatory cascade, right? With hemorrhagic lesions and or even organ failure. Brain lesions, lung lesions, things like that. Sjogren's I grouped under here. Sjogren's is an autoimmune condition affecting production of tears and saliva. And we mostly treat it just symptomatically. But many people with autoimmune conditions, once that first domino falls, then they collect other autoimmune conditions. It's very common for more than 50% of people with Sjogren's have secondary Sjogren's, which would mean that something like lupus or rheumatic arthritis would be their first complaint, and then it kind of rolls downhill. Polymyalgia is unknown etiology, but it's this progressive inflammatory stiffness, pain, and loss of range of motion affecting the shoulders and the neck and hips, along with continuing like fatigue, malaise, and flu-like symptoms. Vasculitis, generally inflammation of the vessels, which can be localized or systemic. It causes a lot of pain due to ischemia, and something related like Raynaud's phenomena, which would be a transient vasospasm in reaction to temperature changes. Can be hot or cold, but usually cold. We'll often when we think about cold B, we'll jump to our arthralgias, right? And so in Western medicine, we're going to look at them. These are kind of four major types of arthralgias. So We have rheumatism. Rheumatism is a specific terminology associated with the aftermath of streptococcal infection. I kind of feel that even though this is a very specific terminology, that with some of our post-COVID patients, we're experiencing a lot of rheumatic type pains, and there is kind of a post-viral fatigue parallel to the idea of rheumatism. But with rheumatism, this initially is generally usually going to be a cold pathology, like cold and damp initially. And then it can affect the joints, connective tissue, and namely the heart and the vessels. Rheumatoid arthritis, spoke about, basically affects small joints like the hands and the wrist associated in the fingers. It's going to be symmetric. It has pain, swelling, rigidity, right? It's aggravated. It's like worse in the morning and then worse with a lot of activity. Osteoarthritis, of course, we know, basically loss of cartilage, leading to eventually bone on bone. Usually we see first occurrence in middle age, going to affect hands, feet, spine, and weight-bearing joints like our hips and knees. Fibrositis is a chronic condition where we have stiffness and pain of the muscles, tendons, and the joints. And the patient often has anxiety and an inner restlessness. They are fatigued but restless. It's often, they have complaints of both anxiety and depression, and there can be GI dysfunction, either chronic constipation, chronic diarrhea, or a mixture. We don't have a focus on the etiology of fibrositis, but it's thought to be autoimmune related. So all of these possibilities kind of exist under this idea of B syndrome in Chinese medicine. And the terminology of B, we know, just means obstructive syndrome. It can be obstruction from qi stagnation, blood stasis. It can be often, most commonly, wind, cold, and dampness in some ratio. Things can be cold predominant, wind predominant, damp predominant, we can have B syndrome, we can have nasal B, we can have heart B, right? So here, when we talk about rheumatic pain, we are talking mostly about bones, joints, soft tissue, ligamentous tissue, rather than, and then in some cases skin, rather than necessarily organs. However, once we have B syndrome, right? Say we have a cold exposure that gives us achy joint. If it doesn't get resolved, it very easily will go into the vessels, right? Or it can end up in the sinew channel, right? And then later down the road, we can get organ involvement, right? If somebody has something like they had a leg fracture and they have a pin, right? All these metal implants are going to pull in cold into the body. This can lead to somebody having their fracture fixed, but then they have ongoing joint bone pain, right? From cold drawing in. Over time, that can lead to the kidney, right? The kidney B, right, being affected in that way. So we have like decrease of, kidney function due to cold. So it can get pretty pervasive. I am always saying in class, like a pathology mainly wants to come into your body and use up all your resources and keep moving deeper and deeper and deeper until you die, until they consume all your resources, right? And the strength of our bodies at different levels and treatment interventions are what is going to determine whether we can resolve pathology or it's going to keep pulling deeper, right? So here we're talking mainly about cold, but cold often doesn't necessarily come alone. It'll often come with some percentage of wind and dampness. Even if it comes as a clean cold strike, over time, short time, it's going to cause chi stagnation and then blood stasis and development of phlegm dampness, right? We know everybody has to keep moving forward in their channel system in order to be happy and harmonious. So just as a general refresher, we know the main presentation and personality of cold is stagnating, right? Cold is the Debbie Downer of our 6 evil pathologies, right? It's a yin pathology. It causes stagnation, right? Here we see, these are some clips from the Siwen. Among the different types of qi, cold is the one that hardens, right? This is often an origin for a variety of masses. Cold invades a vessel and slows it down, congeals the circulation of qi. So it's going to make things constrict, right? And this kind of localized stasis and ischemia, as well as doing things when it's coming from the outside, is going to block exchange of yang qi, and blood, and we'll get pain, right? Cold injures the blood. Cold really easily goes into the vessels. And so what we'll see with some of the formulas I'm going to look at tonight is that yes, do we need warm, acrid, moving herbs to be dealing with cold? 100%. But we also have to attend to the blood aspect of it. We have to both expel cold, we have to move qi and blood, we have to oftentimes nourish blood to fully repair from damage from cold. When pathogenic influence in the muscles and the bones is very cold, it will create stiffness of the muscles and pain in the bones. I think most of us know that experience. Cold pathology, because it is so stagnating, is associated mainly with pain. When we talk about cold B, the terminology is actually tong B, which translates as painful obstruction, right? It's probably the most severe pain. We certainly expect some improvement with application of warmth, right? We like the bundle up, we like the hot pad, we like the warming liniment, we like the heat lamp on it, right? The patient might have an aversion to cold or not. What I want to outline for you, especially when you have chronic pain patients, they may have a kind of this really exquisite mixture of deficiency and excess and cold and then pockets of heat. And they may be like, no, I'm normal. My temperature is normal. Or they may be a little heated even. And things get so much stagnation and nothing moving forward, that the patient's somatic sensation might be different. We certainly expect them to be cold. Sometimes they are, sometimes they're not. We definitely would expect them to be cold to the touch and maybe some sort of dusky discoloration or prominent darker veins on the skin surface in affected areas. And then we may see pressure being something that feels good or not. It depends really. If we have a really acute cold strike, often we're not going to want any pain on any touch at all on that area, and it will be quite tender. That's definitely the sign of a true excess cold, where expelling cold with medicinals like futsa is primary, right? When many of us will have pain and then we'll just love that like hug and the pressure, and we could have excess overlay over deficiency. There's a lot of lifestyle factors that can increase our susceptibility to development of B. I think ones that we hear a lot about is exposure to cold, right? Somebody works in outdoors, somebody works in a restaurant kitchen, right? They are frequently going in and out of the freezer, frequently have their hands in the water, frequently are sweating and then going outside for a smoke break and then into the freezer and then hands in the hot water or the cold water, right? This sort of exposure or exposure to cold, like, oh, I really just need to run out to the bodega, so I don't really need to put on the whole winter coat and all that, is going to leave us open not only for general wind colds, like external pathogen pathologies, it will over time leave us vulnerable to more chronic occurrences of cold B. So when we do something like go to the gym, go to the hot yoga class, go to the sauna, where we're provoking a sweat, and then running home still wet, right? This is a big open door for these sort of pathologies, but it could be somebody who lives in Florida and they have frequent exposure to being in the water, right? We also, I think, sometimes overlook previous trauma. So certainly surgeries, and things like childbirth, menses, especially like prolonged or heavy menses, like losses of blood in that way, emotional or physical trauma, right? When we have an area of trauma, meaning I had a surgery, or I had a broken arm, or I had a laceration, something like that, right? I had a sports injury, I rolled my ankle, right? Once this heals, we're always going to have some level of scar tissue. This tissue and then the channel area that's affected doesn't really fully come back to its previous capacity, right? And so once you're in the 2 to 3 weeks after an injury or some sort of insult, that area may feel healed, but it's going to be forever very vulnerable to wind, cold, damp invasion. It's kind of a weak area and it will pull it right in from the environment. Even more so if people have all sorts of pins or surgical rods or other implants or things like belly button piercing, right? These will draw in cold, right? It's easy to tell your patient that if they have something like dysmenorrhea, that maybe there's a correlation with their belly button ring and maybe they should try it out and see what happens. It's not as easy to tell your patient who has like a surgical implant that this is a problem. Some people that have corrective surgeries that will involve implants or trauma repair, including implants, they will get lingering pain and stiffness, and it's because cold is kind of pulling in. So no matter what their chief complaint, knowing that this is a feature of what's going on, it can be important to include moxibustion for them. It can be important to include things like warming, herbal ointments, or teaching them how to do moxa at home. Oh yeah, Pamela, people who use ice on injuries. Yeah, right. Like if you look at some of our, so here's the thing. I think from the day one in regards to like ice on injuries, there's a place for ice, right? And there may be people that say like, no, there's no place for ice. We're told right from the beginning that ice equals bad, heat equals life, right? But if we're treating something like an acute injury, we are dealing with inflammation and localized heat, right? If you roll an ankle, it gets all swollen and bruised, and it's probably going to be hot to the touch, even if that person is yang deficient. This is a normal reaction in the body. Some people may say, well, ice, right? Rice, rest, ice, compression, elevation. That's a bit falling out of favor because the issue is when you're using things like ice past this like 48-hour, 72-hour spectrum, right? Initially, ice is great at deadening pain. It will manage the inflammation response, although that is part of the body's natural response to stabilizing a joint that's been injured, and it will vasoconstrict, so it will stop bleeding, right? And you'll kind of prevent extensive bruising or hematoma development. And if that person came to your office right after that injury, you might use formulas that include things like shirgao and da huang, right? Cooling medicinals, but they're moving, right? So we may be using cooling herbs, but not anything that's going to engender stasis. It becomes a problem when, especially after that like first 72 hours, but it's definitely seen patients who like 5-10 years after an injury, they're like, I love my icy ice stick, whatever, right? Ice is really good at reducing pain. And so people can stretch it out and whatever. So sometimes you have to counsel your patients on that, use heat in the treatment, and then kind of see how they feel. They may also be doing something like getting chiropractic or PT. And in those type of interventions, or even like a sports massage in some cases, in those type of interventions, you're creating a more acute inflammation. And so it's not out of the realm of, it's not unreasonable to say like, yeah, those patients are often sent home from the PT with an ice pack or something like that. But you always want to end with heat for the vasodilation to get things back in. Qigong exercises to get a patient a dose every day. I mean, I think like, Barry, there's a reason, I'll always say this, there's a reason I'm not up here teaching about Qigong because I don't personally have a Qigong practice. I might, advise a patient, like send them links for things or send them to somebody that I do know that teaches and works in that realm. I definitely do a lot of massage. I definitely, in a kind of a parallel way, talk to patients about stretching and exercises, right? But these are more from like Western PT realm than channel management, right? But I think for sure, I think Qigong, especially if people are not very mobile or, just have a lot of pain, doing those type of internal exercises, or we all know you can do Qigong if you're laying flat on your back or if you're sitting in a chair. You don't have to be very physically able to do anything. Then I think it could be of great benefit. It's almost like when you break your arm, then you should still, and you have a cast, you should still exercise the free arm. If you do, your body will recruit muscle fibers for both, for both the injured arm and the non-injured. And so when the cast comes off, you'll have less muscle wasting. And so I would see like kind of movement with Qigong, even if it's very internal, to be kind of parallel there. What kind of jewelry is cold in nature? Anything metal is going to be cold in nature. Things like putting in earrings are not as big of a deal as some other piercings, but the navel piercing, the little rods that the barbells that go in the navel are sometimes an issue with, pulling cold in for, dysmenorrhea or menstrual pain, anything, irregularity, things like that. Sometimes you'll see people with the rods in the barbell, big barbell in the ear. I've seen a handful of people who may have had it on the top of the ear, that it goes into the low back area, and they got the piercing and then have low back pain. Not every patient, right? Maybe I've seen 100 patients with that, and then maybe 2 that I know of had cold type pain affecting the area where the piercing was, right? Meaning like a low back, and then it improved with the taking out of that piercing, right? But maybe there was like 98 that did not have that effect, right? But when we're talking, it's probably more of an issue when you're talking about the navel, and it's more of an issue when you have an implant like inside, right? When it's pulling it deeper. Yes, Pamela, I'm a big, in regards to like fertility and thing, I'm a big proponent of navel cupping, where you use fire cup on the navel to pull out latent cold. It's a big factor in GYN issues. It's a big factor in chronic pain issues from any gender or presentation, right? If you have an old injury, old surgery, old trauma, you've had invasion of cold. If somebody has ongoing kind of recalcitrant deficiency type insomnia, anxiety, and panic, that can fall under this umbrella as well, right? You can think about things like cold be on a spectrum of like emotional coldness and inflexibility, right? Which could have been after emotional or other abusive trauma or not, right? It could be a part of a coping mechanism, right? But it's the same as the physical body, right? Where things don't get lubricated, things don't have the right warmth and nutrition, and then they get, like the door hinges rust shut over time. So it's a bigger job to open that up for sure. But cupping on the navel and then doing like moxa with salt in a ginger slice after goes a long way to pulling latent cold out of the body. Often when you're the recipient of that treatment, you'll feel qi sensations distally. Like you'll feel the little suction on the navel, but you'll feel qi sensation in your low back, or that ankle that you sprained 10 years ago. And it's really good at pulling things out. Anytime there's anything GYN on the table, or anything there's chronic pain, chronic emotional stuff, where you're not sure what the obstacle is, navel cupping is right where I go to, because it's kind of one of these practices where it's like you're smoothing the bed sheet, right? You're just like, let's clear obstacles, right? And cold becomes a massive obstacle. All of us as adults have our histories written all inside and outside of our body. The person that gives me massage says to me a few weeks ago, he says, by the time we're middle-aged, half of our body is scar tissue. And I can't stop thinking about that, right? There's all of these life experiences. There's like growth, there's like catabolic and anabolic exchanges, and you're making like little micro injuries, which develop some scar tissue, right? These will pull in cold, right? These will engender stiffness and inflexibility and certainly pain. And that can be physical pain, that can be spiritual pain, can be everywhere on the spectrum. I want to speak to pain, that, you know, cold pain, cold related pain is usually considered quite severe. It's what we call jiaotong, violent pain. And it's often, this is really from excess cold. It's kind of like if you've ever had an exterior wind cold experience, especially if it comes in with dampness, it's quite painful. And you really won't get relief until you can relieve that pain. What we talk about with rheumatic pain is often a longer history and things are like all tangled up, right? Cold pain overall is generally worse at night because cold is a yin pathogen, yin type pathology. And so it will show itself more at night. And I don't think I need to stress that, like, you know, we need to make sure our patients sleep, right? And if they're having pain that's preventing them from sleeping, then that has to be the focus of that day's, you know, treatment. But we have all these different like flavors of cold related pain. Latent pain or hidden pain is, I think, what a lot of us experience. It's constant yet bearable, right? It's the person who's like, yeah, I had this old injury and then it's like just there, right? And this is associated with colds due to the vacuum created by qi and blood deficiency, right? Heavy pain, when things get a distended feeling, this will tell us that damp is in the house. And there's often a lot of soreness, tenderness, and generalized fatigue that can come along. Spastic pain that has a pulling sensation is often cold invasion affecting the actions of the liver. We're not getting free coursing, we're not getting nourishment of the sinews and the muscle tissue. Lastly, escaping pain is really correlated with the type of pain we get from cold with wind, leading to some qi stagnation. It's like generally a joint pain that's episodic and moving. So I want to, again, this is not about like what the classics are saying so much, but this is how I kind of approach these things. I want to share a few formulas focused on different areas of the body and different approaches. Chonchong cha tiao san is like a lot of these I'm going to share, like these are kind of some of my like desert island formulas, right? Because the Chonchong cha tiao san is so versatile. It is a Janzhong Jing formula. It's originally for pain in the head pain due to wind. Wind cold, wind heat can be applied for either. Do you need to have an exterior pathology at that moment to make use of this? Absolutely not. We have use of chonchong cha tiao san for what we call intermittent wind, which is often your generally deficient patient who would be more prone to getting a wind cold or cold diseases, right? People that are certainly yang deficient, but also qi and blood deficient are more prone to cold conditions. The beauty of this is, so we can use this certainly for acute headache due to wind. That's what its main application is. But we can use it for chronic upper body pain associated with cold and wind. However, we can tweak it if we want. The original prescription, there's a lot of commentary and conversation about who's driving the bus here, who's the chief of this formula, right? And generally how things are named in Chinese medicine, the fact that chonchong is in the formula name would say chonchong is the chief. However, most people don't think that that's the case. And when you look at the original formula, it's like couple hundred grams of each of these ingredients. In order to get wind out of the upper part of the body, we need an herb that has the ability to track wind. And that's boha here. And it's like something like more than 1,000 grams in this original formula, because boha is light enough to get to the channel pathways on the top of the head, right? Then we have chonchong, baijiu, jianghuo, xishin. These are going to act on different channel systems, right? If you have more pain associated with liver, right, like vertex, then you can have a higher dose of chonchong in this formula. If it's more frontal and maybe with some dampness, sinusitis, we can increase our dose of baijiu. If it's occipital, back in the neck, upper shoulders, we can increase our dose of jianghuo, because this will correlate to that area. If we have pain in the face, or if we have something like a Bell's palsy patient or trigeminal neuralgia, or if we have just a severe pain patient, increasing the dose of xishin, which gets to this area of Shaoyin headaches, this cold entrapment creating pain in the jaw and communicating often to the tongue and the teeth. It's a really terrible, severe pain. But all of these are going to eliminate wind, secondarily deal with dampness, but you can tweak it depending if you want it to go in a particular area. However, in the original, it's quite well balanced. And then this is offset with lu cha. Lu cha is green tea. The cha in the name is green tea. Green tea is cooling, and it's kind of brings qi downward. So it's almost like a balancing assistant to all of these that are more going upwards. But, you know, again, could this be headache associated with wind cold? 100%. Can this be somebody who's had like intermittent moving headaches for 10 years in a generally deficient patient where you think this pathology is from wind and cold? 100%. I've had this also where people have nerve pain after dental surgery, had patients who had like facial reconstructive surgery, and they have pain from nerve exposure, like sinus surgery, things like that. It's cold and wind. Bell's palsy, this can be a good base formula, right? So there's a lot of flexibility with this formula. You know, do things like Juanbitang for wind, cold, damp in the upper body still work? 100%. But I just want to give spotlight to a few lesser used ones. And one of my favorites is Huangqi Guizhi Wu Tang, right? We can see this is when things are cold predominant. We see Guizhi, Baishao, Dacao, Shengzhang. This is Guizhi Tang. It's Guizhi Tang plus Huangqi, right? But other than having an awesome, fun name to say, it gives us this like strengthening, activating the yang, and stopping pain and spasms for a generally deficient patient. And it directs things to the upper body. So Guizhi and Baishao, if we're using Guizhi Tang, if we want to make somebody sweat and release the exterior, Guizhi and Baishao have to be 1-to-1. Can be 9 grams and 9 grams, can be 20 grams and 20 grams, doesn't matter, but they have to be 1-to-1. If you have more Guizhi than Baishao, you're really focusing on activating the yang and activating the yang and expelling cold from the vessels, right? Which can be part of stopping pain, right? Here we have Baishao is like a little more than double our Guager. And so the focus of this is more about like expelling cold. Guager is what I call the door opener of this formula. It's expelling the pathology, it's moving the cold, it's activating the yang. And the Bai Shao is nourishing and stopping spasms, spasmodic pain. Huang Qi here is not only going to be tonic of spleen and lung and the dong qi, the gathering qi in the chest, as well as stabilizing the exterior and the wei qi. Anybody that's deficient will be more prone to exterior invasion. But it's also lifting, right? And so all of this kind of is bringing up this lovely, like, let's stop spasming in the upper body. This can also be a headache patient. This can be a trigeminal neuralgia patient. This can be pain from cold that's like spasming for the in the neck and shoulders, right? Like even a whiplash patient, right? If you had a traumatic injury to this area, I would probably add some blood movers to the mix. But this is a wonderful baseline. I've used this a lot on patients with facial pain or shoulder pain, like anterior shoulder pain, where it's the kind of thing where you have a repetitive use injury and then you just feel it. Like one day you're like, oh, this came on all of a sudden, but it's kind of like a leak in the ceiling, like it's been going on for a long time before that. Also very good for upper body, feng feng tong. Feng feng tong, we have things like Gegan, we have Ma Huang, Kuang Qin. These are bringing this formula, the actions of this to the upper body. This is good when we have both cold and damp causing the pain, right? But things like Fang Fang, of course, our guard against wind, will expel both wind and dampness. Fang Fang with Dangui is very good at moderating spasming, right? You ever have a situation where you have like, oh, I think for the last week I've had like an eye twitch, right? Like it's just there. It's not painful, right? Or a lot of clicking in the hands, the shoulders, the neck, not necessarily pain. That's usually just wind entrapment, right? And so Feng Feng is really good at getting kind of ferreting out that wind with little pockets of dampness. When it's supported by Dangui, we have this kind of relaxing antispasmodic feature coming up in the rear. So it's relieving of this kind of heaviness, right? Things like Fang Fang Gegan will release the exterior, but we're not necessarily requiring an exterior pathology here, right? We're talking more about wind, damp, B. Gegan is especially expert at neck pain, especially SCM contraction, right? It releases the muscle layer, especially in the SCM. When we have something like cold pathology stuck in the channel system of the upper body, it gets just like stiff. It's like this lingering stiffness, the neck and the upper back, right? Dangui, we said nourish. Chi Shao, we need to get circulation going. Qin Jiao supports the Fang Fang by expelling the wind dampness, and it relaxes the sinews and opens the collaterals, right? So it's another kind of the door opener. This is going to allow the rest of the formula to get in there. Ma Huang is always the star of the show, because when we need Ma Huang, we need Ma Huang. You know, of course it releases the exterior, but it reduces yang edema, right? Upper body acute edema if there's contraction of cold and dampness, and it disperses cold pathologies. So you can use this for even like upper body masses with a cold root to it. Then we have things like Huang Qin, where we expect if there's cold, and especially if there's dampness, there's some level of when we add cold, it adds to that stagnation potential. When we add dampness to cold, it adds to that stagnation potential, and then it can convert to heat pretty quickly. This one for dampness, we could angle and tweak for upper or lower body. This is really when dampness and cold are our main complaints. This is a very interesting formula. It has our duo pair of, has a little bit of overlap with our chonchong cha tiao san. Has our pair of Changhuo and Duhuo. If you're having a comps nightmare reenactment where we say that Changhuo goes to cervical spine to relieve pain from wind, cold, and damp. Duhuo mostly oriented to the lower body. So together, they're a common dui yao or medicinal pairing to treat pain from wind, cold contraction on the entire spine, right? This is not super focused on the extremities, but you could tweak dosing of things like Changhuo or Duhuo to angle it a little bit more or less to the upper or lower body. However, in most cases, the inclusion of dampness gives things a weight and it will tend to sink. So this may be more common in the lower limbs. We have Ma Huang here as well. Don't be afraid of Ma Huang. We know it's very good in things like cold-based dermatology issues, but also joint pain from cold, damp bee. When you think about using things like Ma Huang, if you've never done it before, I always recommend just going with diagnostic formulas. When you say, this is cold and dampness, and I think something like a heavy dose of futsa or inclusion of Ma Huang is what I need to get through this, give them 3 doses. That's it. That's enough to see a response and a reduction in pain. And if your instincts are not correct, then you're not giving them such a prolonged experience that it's going to have damage. They're mostly going to be like, no, I didn't really feel a change, right? But I think it's a good way to measure these things, as well as sometimes if pain is really heavy, dampness will need to be treated for a longer period of time, but we don't necessarily need to give them Ma Huang based formulas for even more than a week, even though the dosing here is not going to provoke sweating necessarily. We have Chuanwu. Chuanwu is not commonly used internally. And if you don't have access to it, it's a type of aconite. It's fine to use internally. We usually use small doses and shorter term. You can certainly substitute it with regular Jerfutza. As we go into the warmer weather, patients can still have cold B. They are presenting with cold B every day, but we need lighter dosing, and things like our aconites, we do a little bit lighter. Most of these guys are like Sangju, and then our Nom de Plume, Ren. Ren they're gonna cast out dampness. Sangju strongly revives the spleen by shucking off dampness. Guager activates the yang, spells cold to kind of cut through dampness. Ren is our lowly like barley seeds that is known to ferret out dampness even to the level of the bones, right? And then Han Fangzhi. Fangzhi is quite a diuretic herb, so we don't want to use it in the absence of dampness, but we can, it's probably the best choice when pain is due to cold and dampness. It will cause that excess cold and dampness to be urinated out. Yes, Barry. Yeah, Chuanwu and Saowu we treat as the regular any other aconite. The Saowu and Chuanwu have more toxicity than our standard aconite. If you know, if you're doing low doses of these things, you're good, right? Like something like 3 grams, pre-cooking it for 30 minutes is plenty. If you're in a situation where you need to use a heavy dose of aconite, like if you want to use more than 10 grams, when you put in your formula, you request the higher grade of Futsa, and they'll probably give you like a Heiner Fruhofs, like the classical pearls Futsa. But when it's small, it's fine, and you don't have to like cook it extensively. Yang is very timely now. This is more focus on lower body. And so this is, Yang is the naming, it's like, it's about it's about like today, right? Where we're emerging from the cold season and you're in the period where we've started to get warmer weather, and we're in those first days where the warm weather finally sticks around, where you're like, oh, it's not going to be cold tomorrow, right? So this is like a very poetic way to talk about what we call a yin flat abscess, which is basically a contraction of wind, cold, damp in a localized area. It's common in the lower body, especially in the knees, and it creates something that we call Crane's knee wind. It's generally a patient that has general deficiency, qi, blood, yang deficiency, and then because they have vulnerability, they get invasion of wind, cold, and damp. They don't have the gas in the tank. They don't have the mojo to push through that obstruction. And it creates either arthralgia, right? Like joint pain, it will stuck in the joint. Or if it gets stuck in the soft tissues, it can create a slow developing abscess. Often the area will have like you might have swelling of the knees if it's affecting the knee joints, but you can have muscle wasting. Like the patient is generally not super vigorous in form. If it's like an abscess or a boil, or whether it's a more superficial dermatology thing or whether it's a deeper infection, it will be characterized as being like slow developing, doesn't come to a head very quickly or easily, not really about temperature change in the local affected area, maybe duskiness to the skin color, if any skin color change at all. So it's kind of the opposite of what we think about when we think about a heat toxin or a yang natured toxin, which is kind of acute, very angry, red, localized, swollen, red, hot to the touch, comes to a head, develops pus easily. It's very cosmetically upsetting for the patient, but that's actually a very good prognosis because the body's doing what it is supposed to do, which is eject this pathology. And once it ruptures, then it resolves really quickly. When we have a patient that's weak enough to accept this invasion of wind, cold, damp, then and can't get through it, and it's slow developing, it's more likely to do bad things like hit the bone or connective tissue, go to the deeper levels of the body, right? So we need to both open the door, we need to expel this wind, cold, and damp and this like turbidity of accumulation. And then we actually need to tonify underneath. We need to give the patient a little gas in the tank to get through this. So our Baijitsa and ma huang are the main ones that are kind of dispersing this accumulation. Bai jiezi, of course, is the little mustard seed, very fragrant, very aromatic. And ma huang we know and love for making us sweat and all these things, but it's really good at getting cold out of the channels and the tissues of the body. The rest of this formula is activating or tonic of yang and nourishing of blood, right? So here we're using shudi, which seems unusual because we have a accumulation of damp locally, but we need to tonify this patient down to the level of the marrow, as well as the inclusion of shudi kind of and rogueway together kind of brings the focus of this formula to the lower body. And lu jiao jiao is our only yang tonic. Lu jiao jiao is a gelatin made from lurong, the deer antler. So it will also tonify the patient down to the level of the marrow, but it's also very good at repairing sinew and bone, the flesh, right? So when people have deep deficiency and they get overrun with infection. When things get very chronic, we will engender more stasis, usually more development of phlegm damp and more blood stasis. This can change the nature of the pain to this like prickly, pinpricky kind of pain. It can also include more like numbness, tingling, those kind of paresthesias. Here with this sort of thing, we see Sawu, which is a different type of aconite, in a heavy-handed dose to expel internal cold, like the core of the issue. Zhitiannanxing to clear wind, damp, and phlegm from the channels and collaterals, like the smaller vessels. Mo Yao Rushang to break blood stasis and resolve pain by moving blood. And Dilong. Dilong is kind of an unsung hero of all sorts of bee. Insects of all kinds will they kind of crawl through the channel system. And so they can ferret out small pockets of stasis. But when the longer the presentation, the more we have to do some focus on moving blood and breaking blood stasis as part of our treatment approach. I want to briefly speak to chilblains because this is related to some COVID related issues that we've experienced lately. Chilblains is an abnormal reaction to cold exposure where there's like a vasospasming and constriction, things kind of stay inflamed. And you get this kind of dusky discoloration. It's usually affecting the digits, like it's going to affect the fingers and the toes mostly. If somebody, it's going to affect like, people who are like work outside, people who, postmenopausal women, people who are smokers, diabetics, other kind of conditions where you have already a basis of vasoconstriction. It's often it's going to be associated with an exposure to cold. It can lead to not only pain and tingling, numbness, but itchiness. I've seen a lot of patients since the COVID beginning they're like, I go outside and when the wind hits me, I get itchy hives from the feet up, right? Like kind of raises up. It's this cold and wind and this like aggressive over response from the body. And a lot of the times it can be self-limiting or it can find its way into the vessels and the ligamentous tissues, and it will decide it's going to stay there, right? So here on this patient, you can see some hives building up, usually very itchy, right? And it's becoming more common in our people after COVID experience. We have an interesting thing we're calling COVID toes, which from a Western perspective, we would say is it's pseudo chilblains. The reason it's pseudo, it's the same reaction in the body, and it can affect the toes or the fingers, but it seems more common for it to occur to the toes when it's COVID related. But the reason it's called pseudo is because there isn't an external cold exposure. But if we look at the nature of COVID, the initial COVID strike is predominantly going to be cold, right? Some people, it's going to convert very quickly to heat. Other people with a lot of dampness or deficiency, it'll be that more lingering experience, right? But many of us have been left with this experience of arthralgias and stiffness after our COVID expunge. Yeah, Xiaohu Luodan for neuropathy. Yeah, I think so. Yeah. And especially when it's like cold, dampness. But yeah, dampness, it can be commonly associated with like tingling. I think a lot of the times we jump to it always being wind, but when we have like heaviness and it's fixed and we have like a tingly pinprick, that can be from dampness, and that formula would be good for that. COVID toes, I've seen quite a bit of. I've seen people come and be really horrified that they sit down and their whole legs turn purple when this thing that they're calling corpse legs, where it looks really dusky all of a sudden, and doesn't really respond. And it's coagulation. It's like accumulation of coagulation. It's inappropriate, like over response from this level of microcirculation to cold exposure. And so when it's affecting the digits in the office, I'm going to do moxa. And it's really interesting. I've seen over and over, I'll do moxa just indirect over the toes. And that purple pooling comes all the way to the tips of the toes. And then after you've done your moxa for a few minutes, you just bleed all the jing wells. And they're usually very expressive. And then the color, all that muddy color drains right out. You may have to do it more than once. If you're treating somebody remotely, I would get them some aye and have them boil some water and make like a foot soak or a hand soak with it. But I found the best response when we can both bleed, but also like warm using moxa. And, with the people that it's affecting more of the limb, usually the lower limb, I'm going with a Dongui Sinitang base, right? So Dongui Sinitang, of course, is our internal cold formula that's for cold in the channels and collaterals with a background of blood deficiency, where a patient is generally trucking along in life deficient, they contract cold, it gets lodged in the channels and collaterals, and our main sign that we often associate with it is cold hands and feet, right? Or like Raynaud's phenomena type experience, right? Whether that's painful or just discoloration or just cold sensation, and it's icy cold up to the wrists and the ankles. The feature here, you can see we have the architecture of Guizhitong within here with our Baisha, Guizhi, and we have Zhigancao Dacao. So we have the majority of Guizhitong here. But what's really driving this is Xishin, pictured here. If we look at like a doctrine of signatures for an herb like Xishin, where it's like the way it presents kind of informs what it does. We're using these really fine rootlets, and this is so good to get out cold induced pain in very small areas. And when we're talking about capillary circulation or small lymphatic vessels, that's about as small as it can get. And Shishin is on the job. And then Mutong also does this. When we look at Mutong, it has all these, like, it looks like a piece of lace, all these perforations. It eliminates the dampness to open up microcirculation on that level. And then things like Dongwei and Bai Shao will action. Of course, Bai Shao and Zhigan Sao in this ratio makes not Zhigan Sao Tang bunch, where we have it's totally escaping me, where we have like 2 parts of Bai Shao, 1 part of Gan Sao, to stop painful spasming in usually a blood deficient patient that's contracted some cold.
I just want to, we're at 8 o'clock. I just want to acknowledge that.
Yes.
Let you take a breath. I just, yeah, you can keep going, but I just wanted to make sure we knew where we're at, and
yes,
that committed to a particular time frame.
I'm over the hill.
Okay.
And then we'll wrap this up, and anybody who wants to stick around asking questions will be open. I want to just share with you some of my kind of favorite modifications for specificity, right? There's not much better that you can do with like something like addition or increased dosing of something like Shishin or Baijitsu for when pain is related to cold, right? And here's my long group when it's related to dampness. Opening up blood circulation. Honghua is it. Honghua is a big one. Lulu Tong, which we find in all over the New York parks, you find the little Lulu Tong herb on the ground, is wonderful for opening up small circulation. Something like Wang Bu Liu Xing, also good. Ye Jiao Tang and Jishui Tang. If you look at these herbs, they're very porous. They almost look like marrow or muscle tissue. Very good for soft tissue achiness, pain when it's deprived of nutrition because of obstruction from cold and dampness. Spasmings, certainly combination of Bai Shao and Gan Sao. Inclusion within your formula of Shi Shao San, the sudden smile powder, which would be Pu Huang and our flying squirrel feces, Wu Ling Zhi. Gugen, when spasming in the upper body. Mugua, when it's the middle or lower body, right? So these are some of my, sometimes I'll take formulas and then send them somewhere, right? Send it to the top, send it to the bottom, focus more on cold, focus more on dampness, right? And then specifically for pain, if it's cold specific pain, then Shishin is on the job, as well as all your aconite choices. But Yan Huso is lovely, especially for anything really chronic, when we know there's a greater instance of blood stasis. And I just want to point out, you can get all sorts of patents that are Yan Huso and Baijia. Baijia in this instance, because of its ability to like generate flesh, expel pus, it's getting to that level of microcirculation. So it's a common Dui Yao with a kind of a heavy-handed dose of Yan Huso to stop pain. You might use a patent like that even for the first few days, in addition to whatever your base formula is, just to stop pain, and the patient can regulate how often they take it. It also is sedative, Yan Huso. So if your patient is having difficulty sleeping because of pain, Yan Huso, inclusion of Yan Huso, or giving them also a patent of Yan Huso, which there's many of them that are just like Yan Huso and maybe nothing else, or Yan Huso and something that's going to open up circulation. And then they can use it before bed or as needed, right? All right. And I want to just speak for a moment about some other considerations if people are treating people infrequently or like for long periods where we know we're going to need to deal with this for a while, or patients are not super interested in cooking herbs or tasting anything. There are some higher concentrate pre-made formulas. Classical Pearls brand is a favorite of mine. They are granule extracts, but they minimize the level of incipient, and they are 10-1 instead of most granules that are 5-1. So they're very potent. They don't use a maltodextrin, like a inert starch for their binder. They use living green clay. So I've never had people have bloating or digestive upset or anything like that. And the formulas are quite well balanced. He has a common approach to cold B where you alternate, you cycle 2 formulas. The first is what's called Evergreen Pearls, pictured here. And it is based in Dangui Sinitang, right? And so it's going to expel cold, open up that small circulation to stop pain and spasm. It then will eliminate dampness and nourish the blood and resolve blood stasis. So it's pretty well rounded. This is usually alternated with bamboo pearls. Bamboo pearls is based off of, you see in the beginning, Guizhi Xiaoyao Zhimu Tong, which is our classic formula for cold B that's become chronic and developed localized heat, right, with swollen joints. So generally, you give like 4 to 6 weeks of one and then alternate with the other. They're kind of sister formulas, but especially in our kind of post-COVID experience, this has been an easy, convenient go-to for patients with a lot of excellent clinical results. And, you know, I want to note that Dr. Fruhoff is known and associated with being involved with harvesting very high quality futsa. And so his formulas can be very futsa heavy, but you don't tend to find like overheating or other, sometimes if you're using lower quality futsa, it's just you're going to be great for a week, and then the next week they'll start to get heated or they'll have insomnia or something like that. And you don't tend to see that with his formulas. They quite well balanced. Certainly other considerations would be any kind of topicals, warming liniments. Depending on what you're giving your patient, if it's a warming internal formula and they're cooking the herb dregs or they have the herb ground powder, you may ask them to do a soak or a plaster and use it topically as well. Patches. I love patches and hate patches. Patches are great. People love to put something where it hurts. They can be quite penetrating and dealing with cold pain, but they often can lead to skin irritation and they often get overused. So be mindful of that. Pictured here is one that I love. This is a mugwort plaster with itang, like maltose sugar, and like has sanchi. I've not had, it's very easily found. The plaster is treated with far infrared. And so it's very penetrating. It gets super hot. I've not had an incident of pain, of skin irritation from this. So I've continued to use that. Certainly moxa. If you're not with your patient, things like moxa essence, moxa balm, moxa essential oil, when you're using something like moxa balm or one of these non-heated products, they have to apply heat to get the penetration. So it could be at the end of the day and they're watching TV with a heating pad. Lastly, something that I like to do when people are like, oh, I had this old shoulder injury and then I had 12 surgeries and all of these things and it's just stiff and I want to do my running plan and all this stuff. is using like a trauma pill, right? So things that we usually use for acute and subacute injury, using it just like briefly, 1 to 3 days, 1 to 3 doses to clear out old stagnation. Liangsai Xindai Dawan is a easily found at Kamwo on Amazon cheap patent that contains Yanhuso and Baijiu and Dilong and all of these kind of like opening and cold expelling herbs and pain relieving herbs. And I think there's like 6 capsules or something in the box. And so essentially you just take the whole box. You just take it like twice a day until you're done. And this has been proved very good when you have this kind of stubborn, chronic, low level, continuous but bearable pain. It can help get you beyond that. So I warned you that I talk a lot. I'm open to any questions if people have or want to stay, but I thank you for joining me tonight. I am doing a series which I'm waiting for CEU approval on pain management with herbs that will be on-demand webinars, like 3 hours each, that can be taken. And those I'll have on my website. So hopefully sometime middle of maybe June is probably an appropriate time frame there. But thank you so much. If anybody has any questions, I'm happy to speak to them, or we can just hang out in space because it's nice to see familiar faces.
Chava, I actually have a question about your dosage of shishin.
Yes.
So it's way higher than what we were taught in school, like 1.5
Sure.
to 3. And if you give more than 3, like the world will end. So
yes, it could.
Is that because you're using it for shorter duration, or are you clinically finding that you can go that high and people are not going to?
A little bit of both. It's a good question. I also want to speak to the fact that sometimes like shishins like mahuang, like people get too scared to use it. I think in this case, it's super needed. Like you really have to get on it. It just can get in there in a way that everything else cannot. Some herbal vendors, their insurance does not cover them to carry shishin because it's an Aristolochia species. Kamwo has it. I think Fat Turtle in LA will have it. Not everybody has it, right? So some of them won't be included in your formulas, but it's worthwhile. It may not be available in raw. There's only like one channel to get it coming in. But you can have a raw formula and you can use the shishin and granule to very good effect. So dosing, yeah, we remember that what we're taught for dosing comes out of Bensky, which is a lovely, massive book made for Westerners studying this medicine. And the dosing in Bensky universally is very mild and moderate. What I have on some of these slides are like the original dosing. So some of it's like, oh, we're taking 180 grams of aconite. You're making a batch, right? And then if you look at the original instructions, it will say like, and take 6 grams before meals kind of thing. So the dose really isn't that out of range. Here, the dose is definitely more than we expect. You probably do not need prolonged high dose of shishin, right? Maybe the first 2 or 3 days you could be that high, but cold, acrid herbs take qi, right? And so we don't want to dry out our patient. We don't want to exhaust them. If there's dampness, then you'll probably have a longer range, but maybe after like 3 days, if somebody's in acute pain from cold, I might send them home with 3 days worth of formula with these high loading dose formula. And then they just email me or call me and I may refill it, but maybe now I'm like 2 or 3 grams of shishin, right? Depends on their response. But when pain is from cold, heavy dosing is appropriate, at least in the first couple days. Yeah, the dosing in the formula is the daily dose if you're looking at it as raw, right? So quite honestly, if you were going to take some of those and make them into by granule, I wouldn't change it either, because granules are usually 5:1, meaning you've used at least 5 grams of the raw herb to get 1 gram of the granule. So the conversion is about the same. So then those doses become what you would put to make a bottle, to make like a week's worth or something like that. So, you know, and in relation to things like ma huang is another sticky point. It's not illegal. It's not dangerous. It's like most everything else. We have a known and accepted clinical dosing range and clinical application, right? So if you're using ma huang to make somebody sweat, then you're really only giving them, I might send somebody home with 1 or 2 doses of that formula, because then they sweat. That's really all they need. If I'm dealing with a B syndrome or a dermatology thing or an abscess or a boil that's cold in nature, I might have them on a ma huang formula for 2 weeks. Maybe even longer, but not 10 grams, maybe 1 to 3 grams. And then within the context of things that are moving blood, nourishing blood, and kind of anchoring the other side of that. So we're making benefit of ma huang's warming acrid nature, but we're not necessarily pushing to activate their yang to sweat all the time. Not every dispensary will have ma huang, right? It's legal to have, but it's a very big gray area. We know we can't have it in pre-made products. There's a few places in California, again, Fat Turtle is one, Kamwo on this coast, that do carry ma huang. We can't always get it in raw and granule all the time, but you can do a raw formula and then include it as granule. Like granule is pretty much always a given, and then the ability to get raw is always somewhat fluctuant. What I recommend practitioners do, because the vendors can't sell it in bulk, is to order for themselves to have on hand a few classic ma huang focused formulas. And then when your patient comes in and you need it, you have it, right? Because if you need it for something like a wind cold, you have a very small window of that as well. Anybody else? I'm interested, like I've had a lot of patients come like after COVID vaccines with cold B. Because of the location of the vaccine, a lot of it is either going into the sanjiao, mostly, maybe a few instances, the large intestine channel. The sanjiao channel, I will have them have not only headaches on that side, neck pain, also deltoid pain locally, and then it tends to come up also on the shin, like around the 37, stomach 37, 39, in there in the lower Hasi area. And so it really distinctly will follow the channel pathway. For those cases, I've been mainly doing moxa, and that's usually you do it once or twice and it's gone when it's a vaccine response. But I saw enough of it that I got into pre-treating people for their boosters. And I've usually been using Chaihu Guizhitong, right? So we're kind of expelling cold pathologies, harmonizing yin and wei, and resolving Shaoyang as well. And seeing that is do good effect. They could take it maybe 30 minutes prior to their vaccine and then send them with like 4 or 5 doses. So they take it for like maybe like 48 hours, 72 hours afterward. It's not going to change the effect of the vaccine, thankfully. They'll still have the benefit, but it will minimize or eliminate development of side effects, especially those experiences where you have these lingering cold joint pain or channel pain or headache after the vaccine.
I also sort of apply some gua sha, like gua sha and cupping has
Yeah.
been really helpful both before and after, because we're all just so kind of like jacked up here, like just living like it's all, tight to begin with. throw in a vaccine, and it's even more. So some of that manual therapy really is very beneficial as well. I'll throw
Yeah.
in that I added just during the chat. I just sort of, it's not related because it's not herbal and it's not talking, but there's this great kind of review on the evidence on non-pharm therapies for pain. Just
Yeah.
because that's the sort of realm, this is from 2018, but this is the realm where I think being articulate and having either any Chinese medicine strategies, where it's herbal or acupuncture, manual therapies as alternatives for folks that otherwise would just get prescribed pharmacological kind of options. It's good for us to have some background in terms of how we can actually make a different kind of impact.
Yeah, is that the white paper related to the opioid crisis, right? And this push towards like the non-pharmacological, yeah. And our medicine is kind of like right up there as a recommendation. And I think that, I love acupuncture. We all love acupuncture and cupping and gua sha, but like I think I would love to see more conversation and inclusion on herbs. And I think there's some hesitancy on the part of practitioners as far as like maybe like confidence in prescribing and utilizing. And then there's certainly hesitancy all over the place about things like examining quality control and herb drug interactions and all these things, right? However, we have we have a lot of that information, right? Like we have a way to navigate that. Yes, Chai Hu Guizhi Tang pre-vaccination, and then usually for like 48, 72 hours post seems to do well in resolving any kind of like cold retention in the channels. I would say also, and Donna and I have talked about this, in most cases with vaccine response, we've seen a lot of varying things, right? And I know initially there was this big conversation about infertility and dysmenorrhea and all this stuff. And, it's everything's better if you don't look at the news and all that stuff. But what I've seen mostly is things are quite superficial and really responsive to treatment, like very immediate when we have cold related pain, right? Because the vaccines are cold, as is the COVID virus. We can expect pain, as part of this. And, but with the vaccine related pain, it's really been in the sinew channels, in the surface vessels, and it's responded very immediately to heated intervention with not a lot of use of internal herbs and like strong medicinals.
Great. Well, I am going to call it because it's 8:21. There's no
Thank
end,
you so much, guys.
no end to picking your brain. And hopefully there's more. And it's really great to have you sort of talk this through and the rationale and logic and getting tickled my brain on sort of the whole herbal application, which is awesome. So thank you all for being here. And Kamwo will send you your coupon for.
Thank you, guys.
See you all.
Have a good
night.
night.
Thank you, Chava. Thank you, Donna.
Bye.